Welcome to Opinion Journal Live. I'm Dan Henninger. Edie Sundby, a cancer patient in California, has written an account of her story in the Wall Street Journal today. It describes the recent cancellation of her insurance coverage there. Ms. Sundby has fought bladder cancer for 7 years and has assembled an extraordinarily powerful collection of doctors, hospitals, and insurance coverage to help her wage this battle. But now it is suddenly gone because her insurance has been canceled. Mrs. Sundby, thank you for joining us to talk about what has happened to you.
Thank you, Dan.
Tell us what you've been able to accomplish in terms of a little bit more in terms of your medical care. It's really quite a remarkable story, Edie, of what you assembled in terms of doctors and hospitals to help you with this battle.
Well, when you get hit with the news that you have cancer and you find out that it's catastrophic cancer, it's in many organs, and you have just a few months to live, things take on a new urgency and you don't have very much time. And so I was told here in San Diego, and again, this is before the our good Cancer Center was established at UCSD. This was in 2007. I was given less than 3 months to live. And doctors were talking about palliative care. And I freaked out and just said, hey, I really want to try to fight this. And so did an enormous amount of research aided by my husband, my friends, myself. And we were lucky to find a wonderful oncologist at Stanford Cancer Center, Dr. George Fisher. And I had a consultation at Sloan Kettering in New York. I had a consultation at MD Anderson in Houston. But because George Fisher, we had a very personal connection the very first time we met. And because he was here in California, it was an easy choice. And Dr. Fisher said a couple of things to me when I first met him. First, he put his arm around me, my shoulders, and he said, Edie, I don't promise I can cure you, but he said, I will treat you, and I will treat you to the best of my ability. And
treatment both there at Stanford in California and at MD Anderson in Houston, one of the best cancer centers in the country, if not the world.
Yes. I went to MD Anderson because Stanford Cancer Center, a liver surgical team did some wonderful surgery in July of 2007. Very radical and delicate surgery. And so when the cancer came back in my liver in 2011, they really didn't want to go in there again. And so I had to seek another option. And so I found, again, you have to respond very fast. So I put out, I did some research, and with some help from friends, I found Dr. Steve Curley at MD Anderson, who said, Edie, this is challenging, but it may not be impossible. No. And that's what you listen for when you have catastrophic cancer is you listen for the words, sure. It may be possible.
Now, Edie, your coverage has been carried by United Healthcare, and they've paid out about $1.2 million for your coverage without really questioning it. Now suddenly this has all gone away. What has happened to you?
Well, what happened is, they canceled all the policies in California, the individual market and small business. And so they pulled out completely. And I was affected by that pullout. And I just want you to know that one of the reasons I wrote the article is because we're hearing today how bad insurance companies are. We actually heard this in 2009 and 2010. I was a little surprised by that. And I actually wrote the Los Angeles Times about how good my insurance was and what they'd done for me. But no one ever followed up on that because that wasn't the story then. And so United Healthcare has been fantastic, but it's not the company, it's the people. Yeah. I can't tell you how many times I know the people in claims personally and how many times that they have helped.
Edie, your option now is to go into something called Covered California, which was the exchange created by the Affordable Care Act. And the important distinction here, I think, to make is that what you were doing was something that you had done of your own choice and your own volition. You had the ability to assemble these doctors and these hospitals I take it what you're finding now is that that is just proven virtually impossible for you to do. You've talked to Covered California about trying to do it.
Yes, I think with the health exchanges, there's probably some very positive things about them, but there's a lot of control there. And when you're hit with a catastrophic disease, you have to be in control. You have to be able to see doctors quickly. That's one of the reasons I selected this plan in 2005 for our family. I selected the United Healthcare PPO plan because I knew, and it's a catastrophic plan, and that's what I was planning for. I hoped I'd never use it, but if we needed it, I knew that I could go anywhere in the United States, or my family could go anywhere in the United States for medical coverage.
Edie, it's an extraordinary story. We are very grateful for you for sharing it with us, and we do wish you the best of luck. Thank you for being with us.
Thank you, Dan.